Stanley Evans is an 80-year-old and has a history of ischemic heart disease, congestive cardiac failure and chronic kidney disease stage 3. He prefers to be known as Stan. Stan lives alone in his own home, with carers that visit 4 times a day, and his wife Doreen died 10 years previously. He is visited weekly by his daughter Sandra, as he is now housebound. He has recently felt unwell with what he brushed off as a chesty cold, not wanting to make a fuss. His evening carer noticed that he was much more unwell than the previous night and had a mottled rash on his legs, so called his daughter Sandra and 111, who transferred to 999 for triage. Stan was taken into the emergency department by ambulance with suspected sepsis. The emergency department advanced nurse practitioner assessed him and diagnosed. Despite treatment, after 1 hour, Stan's condition continued to deteriorate. The emergency department consultant reviewed him and requested an intensive care unit review and asked the emergency department nurse practitioner to talk to the patient and his daughter about resuscitation, as he is acutely unwell and at risk of sudden deterioration.
ReSPECT documentation includes a resuscitation recommendation within the nationally recognisable document and will replace the nationally varied DNA CPR forms. DNA CPR forms should be recognised as valid in an emergency situation, as there will be a substantial period of transition whereby historical decisions have been documented on DNA CPR forms and will still be with patients. As soon as it is appropriate to do so, a wider ReSPECT conversation should take place and the recommendation should be reviewed and transferred onto a ReSPECT form. Remember, a patient having a ReSPECT form does not necessarily mean that resuscitation is not recommended for them.
The ED nurse practitioner initiated a discussion with Stan and Sandra. He builds on their understanding by explaining the critical nature of Stan's illness and the need for intensive care review. He clarifies with Stan what his current level of function is at home, and moves on to asking about any previous discussions or thoughts about his wishes in the event of his heart or breathing stopping. Stan confirms that they have not discussed it before, and further discussion clarifies exactly what resuscitation means and what procedures are involved. It is explained that treatment is given to try and reverse the problem, but if it becomes clear that the condition is not responding or further deterioration, then at the point of cardiorespiratory arrest, it is extremely unlikely that any resuscitative measures will be successful. And if they were successful, may leave Stan experiencing a greatly altered quality of life, therefore it is not recommended. The nurse checks that Stan and Sandra understand the information and is given an opportunity to ask further questions, and then confirms that he would not want CPR attempts if that happened. The ED nurse practitioner completes the ReSPECT form, signing the DNA CPR section of the form. The ITU doctor then arrives and the ED nurse practitioner explains the situation so far and asks for the help in completing the other detail in section 4, clinical recommendations for emergency care and treatment. It is decided that admission to ICU would not be appropriate, but ward-based care, including active treatment with IV fluids and antibiotics, should continue. Stan is admitted under the care of the acute medical team. The Amber Care bundle is commenced as Stan's outcome is uncertain at this stage, and a review of his care pathway and preferences will require regular review.
You should review a ReSPECT form at the request of a person or their family if the person's condition significantly changes or if the person moves from one care setting to another. If the patient's condition or wishes have significantly changed, a new form must be completed. Ensure that cancelled is written diagonally across the form in between 2 solid lines. The old form should be folded and filed in the patient's notes as an important record of historic decision making.